Okay, here we go. Okay, so this is the 360 view. We have a bit of an audience. Here's our patient. Okay, all right. Okay. 26, see. Okay, that should be okay. Okay, all right. Hi, my name is Jacinta, and I'm going to be performing a neurological exam on you today.
Okay, hello.
Okay, all right, hello. Okay, so we're going to start by looking at some of your cranial nerves. So your first nerve is an olfactory sensation. So we're going to go ahead and actually test your sense of smell here.
Okay.
So I want you to go ahead and just tell me what this smells like.
Citrus.
Okay, and can you smell it from both sides?
Mm-hmm.
Okay, excellent. All right, and then your second cranial nerve is your optic nerve. So we're going to test your vision a little bit. Here I have a Rosenbaum test. So I'm going to have you hold this just about where you would normally hold like a book that you were reading. And then I want you to cover up one eye. And I want you to read the bottom line that you're able to clearly see the letters.
LTFPH.
Okay, excellent. And then go ahead and switch hands. And then I want you to read the bottom line that you're able to clearly read backwards.
HPFTL.
Okay, excellent. Great job. That's 2020. All right, and then I'm going to go ahead and take a little bit of a look at your pupils here. So I'm going to take a look at each pupil, and then I'm also going to do convergence. So I'm going to be looking at the other pupil and how it responds when I look at this one. So I'll look at each one twice. Okay. All right, very good. And go ahead and blink a few times. All right. Pupils are equally round and reactive to light. And then we're going to test another couple of central cranial nerves. So I'm going to have you follow my finger with just your eyes. So try and keep your face just looking straight ahead, but just move your eyes. Okay. And then forward and out. Okay, all right, very good. Good job. All right, and then I am going to go ahead and check your fifth central or cranial nerve. So I'm going to have you, when I ask you to, go ahead and just clench your jaw. Not yet. Go ahead and clench. All right, and clench. Okay, and clench. Okay, excellent. All right, now I'm going to have you close your eyes. This is kind of a sensory nerve test, so I want you to tell me whether you feel just a light touch either on your forehead up here or on your cheeks or down along your jaw, okay? All right.
Cheeks. Forehead. Jaw.
Okay, excellent, very good. Okay, all right, and then now we're going to do your facial nerve number 7, and so we're just going to do some different expressions. Can you raise your eyebrows for me? Okay, big smile, let me see your teeth. Very nice. Okay, I'm going to have you puff out a big breath, like puff your cheeks out. There you go, just like that. And then I also want you to squint your eyes tightly closed. Don't let me open them. Okay, very good. Good job. All right, and then this next one is your 8th cranial nerve, which is your acoustic nerve. So I'm going to be testing your hearing. I'm going to do a very soft sound. So I'm actually just going to rub my fingers together. Can you hear that?
Mm-hmm.
Okay, so I'm going to have you close your eyes, and I'm going to do that, and I want you to tell me whether you hear that in your right ear or your left ear, okay?
Right. Right. Left.
Okay, excellent, very good. All right, and then we are going to do our glossopharyngeal and vagal nerves. So I am going to have you say ah for me. Okay, excellent, very good. And then I also want you to stick your tongue out and wiggle it, like point your tongue from one side to the other side. All right, very good, excellent. Okay, and then I want you to shrug up your shoulders, push against me a little bit. Very good. Okay, go ahead and relax, excellent. And then I want you to turn your head against my hand. Okay, and then other side. Excellent, very good, good resistance. All right. Okay, and then we're going to test your coordination a little bit. So I'm going to start with having you do an alternate thigh tap. So we're gonna tap, yep, very good, very good. Okay, and I know your feet aren't all the way on the ground, but let me, yeah, you can scooch forward a little. Go ahead and do the same with your toes, alternate toe taps. Excellent, very good. All right, you can go ahead and scooch back a little bit. All right, so now I am going to do some more upper body coordination. So I'm gonna have you touch your nose with one of your hands and then touch where my finger is. Touch your nose again, touch my finger, touch your nose again, touch my finger. Good, all right, other hand, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Excellent, very good. Okay, and then I am also gonna have you take your heel and put it along your alternating shin and run it up and down. Up all the way and down. Okay, and then other side, up and down. All right, excellent, very good, very good. Oh, you know what, and we're gonna circle back and do one more cranial nerve thing. So, because I just missed it earlier, so this is an ocular one. So I'm gonna have you cover up one eye, and I'm gonna wiggle my fingers. I'm kind of testing your peripheral vision, so I want you to just look at me, but tell me when you see that, okay? And I'm gonna do the same thing so I can test how when you see it compares to when I see it, okay? All right, so I'm gonna do this. Tell me when you see my fingers wiggling.
Right
But
there.
look straight ahead, right here?
Right there.
Okay, all right, how about now?
Right now?
Do you hear it, see it now? Okay, all right, I'm gonna switch arms,
Right, I can see it now.
okay? And,
Right there.
okay, all right. Okay, let's switch hands, other eye. Okay, tell me when you see my fingers wiggling,
Right now.
okay? And when you see my fingers wiggling.
Right now.
Okay, now you keep your hand the same way. All right, tell me when you see my fingers.
Right now.
Okay,
Right now.
okay, and one more.
Right now.
Okay, excellent, very good. All right, okay, I'm gonna go ahead and have you stand up. We're gonna do some testing of your gait. So I'm gonna have you stand kind of over here in the corner, perfect. Now I'm gonna have you walk forward like 3 or 4 steps, just regular walking. Excellent, okay, and I'm gonna have you turn around and I want you to walk back, but I want you to do a heel toe step, kind of like you're walking on a tightrope, okay? Yep, very good. All right, now I want you to walk back on your toes. Okay, and then turn around and come back on your heels. Excellent, very, very good. All right, last thing before we sit down. Well, we got a couple more things. I want you to hop in place a couple times. Okay, excellent. Now before we sit down, we're gonna do a couple of stance checks. So we're gonna do a Romberg test, which I'm just gonna have you close your eyes, keep your hands down at your side just like they are, and I'm just gonna have you keep that position for a few seconds, okay?
Okay.
Go ahead. Okay, excellent. Go ahead and keep your eyes closed. I'm gonna have you do the same thing, but bring both of your hands forward in front of you, out all the way, yep, and just hold them there. And I'm watching for any kind of drift or positional drift, and that looks great. Okay, go ahead and have a seat, and that's a pronator drift test. And then we're gonna start testing some strength things. So we're gonna start with your elbows. So I'm gonna hold your elbow here. I want you to go ahead and make a fist, flex, and try to push down, okay? And now try to pull up. Okay, excellent, very good. Other side here, try to pull up, okay? And then push down against me. Excellent, very good. Okay, all right, and then we are gonna do, okay, go ahead and make fists with your hands. And then I'm gonna have you, not using your arms, but just your wrists. I want you to try to push up against me. Excellent, very good. Okay, all right, now I want you to spread your fingers out like webbed hands and keep them straight. Don't let me push them together. Very good. Okay, excellent. And go ahead and put your thumb and your pinky together. Don't let me pull them apart. Okay, excellent. All right, now I'm gonna go ahead and have you take both of my fingers. We're gonna do a grip strength test. Squeeze. Excellent, very good. Good. Good grip strength. And okay, now we're gonna do a little bit on your lower body here. So I want you to push up against my hand, okay? And then push down against my hand. Excellent. All right, same over on this side. Push up against my hand and down. Okay, now I want you to push out against my hands. Excellent. Pull back in. Excellent. Okay, now we're going to do some down along the lower leg. So I want you to extend your knee out. Okay, and then I want you to bring it down. Okay, all right, same on this side. Extend it out. Okay, and bring it down. Excellent. Okay, now we're going to do dorsoplantar and dorsiflexion. Plantar flexion and dorsiflexion, and I'm going to have you push down like you're pushing on a gas pedal. Okay, excellent. And then I want you to push my hands up. Okay, very good. All right, excellent. Okay, and now we're going to move on and we're going to do some sensory test touching. So first, we're going to do like a light touch. So I have something sharp and something dull. So go ahead and hold out your hand for me. So this is going to be the sharp, and this is going to be the dull, okay? So I want you to tell me two things. I'm going to have you close your eyes. I want you to tell me whether you feel a sharp sensation or a dull sensation, and I want you to tell me where you feel it, okay?
Okay.
All right, here we go.
Sharp on the left.
Left what?
Oh, left arm.
Okay, all right.
Dull on the right arm.
Okay, and you say like forearm or the...
Forearm.
Yeah, there you go.
Sharp on left forearm.
Okay,
Dull on the right shoulder.
okay,
Sharp on the left finger. Sharp on the left thumb. Sharp on the right knee, leg area.
okay,
Sharp on the right pinky.
okay,
Sharp on the right thumb.
okay. All right.
Sharp on the left pinky. Sharp on the right lower leg. Sharp on the left lower leg. Sharp on the right big toe.
Okay, excellent, very good. All right, okay, now I am going to have you do some special tests. So we're going to do a, I can never say it right, proprioception. So I'm going to hold your foot here. I want you to tell me whether your toe is being moved away from you, like up, or well, towards you is up, and then away from you down, or to the right or to the left, okay? Go ahead and close your eyes.
Up towards me. To the right. Away from me.
Okay, we're going to do the other foot.
To the left. Towards me. Away.
Okay, very good. All right, okay, and then we're going to do some vibratory sensation. So I don't have a tuning fork, but we're going to pretend this is a tuning fork. So I am going to touch it to your joint, and I want you to tell me when you feel the vibration stop, okay? Or if you don't feel a vibration at all, let me know that, okay? All right, you ready?
Stop.
Okay.
Stop. Stop. Stop.
Okay, excellent. All right, very good. All right, so now we are going to do something called stereogenesis. That's where you are going to determine what an object is just by feeling it. So we're going to close our eyes and hold our hand out. I want you to tell me what this item is just by feeling it.
It's a pen.
Yes, very good. All right. All right, what about this one?
It's a claw clip.
Yep, very good. How about this one?
Soft, scrunchy.
Mm-hmm. And what about this one?
It's a small hair tie.
Okay. How about this one?
Popsicle stick.
Very good. Excellent. Great job. Okay. And then we are going to do something called graphesthesia. So I want you to hold your palm out again. I'm going to write a number into your palm. I want you to tell me what it is, okay?
4.
Very good. We're gonna do the other side.
5.
Very good. Excellent. Okay. And then we are gonna do 2-point discrimination. So I'm gonna touch a point in your body, and then I'm gonna have you tell me where you feel it and whether you feel 2 or 1. Okay? All right. So
2 on my
well,
right.
you don't need to tell me
Okay.
where it is. Just tell me whether you feel 2 or 1.
2. 2. 2. 2. 2. 1.
Okay. All right. Now we're going to do a test called extinction. So I am going to touch in 2 different spots. I want you to tell me if you can feel which both spots are. Okay. All right.
My left lower leg and my right hand.
Okay. Very good. All right. And then we are also going to do point localization. So I want you to tell me this time where you feel this.
Left shoulder.
Okay.
Right thigh. Right lower leg.
Mm-hmm.
Right lower arm. Left lower arm. Right middle finger.
Mm-hmm.
Left big toe.
Okay. Very good. All right. Now we are going to do some meningeal signs. So these are some things we are looking for. The first one's going to be called a Brudzinski sign. So I'm going to have you lay down flat on the bed for this. Now I'm going to be manipulating your neck, and I'm just watching for any flexion among your leg or hip joints, and also I want you to tell me if you have any soreness or stiffness. Okay?
Mm-hmm.
Okay. No soreness or stiffness?
Nope.
Okay, excellent. All right, this next one we're going to stay lying down. It's called the Koenig sign. And we're going to flex your hip and your knee. I'm kind of checking for smooth movements, but I also want you to tell me if you have any stiffness or pain, okay?
Okay.
Anything?
Nope. All
Okay.
good.
All right, excellent. All right, we have one more while you're laying. We're going to do the straight leg rise, and at this one I'm going to be looking for any shooting pain in your lower back that might indicate you have a herniated disc. So let me
Okay.
know if you have any shooting pain.
Nope. All good.
Okay.
All good.
Okay, excellent. All right, you can go ahead and sit back up. And I'm going to have you do something called an asterixis sign. So I want you to put your hand up like you're stopping traffic. Okay, and then I'm just watching for any flopping or anything, but it looks nice and sturdy. Okay, so next we're going to do some reflexes. Now, normally I would use a reflex mallet for this. I do not have one of those, so I did a little research and found that you can use the last inch of the stethoscope. So that's what we're going to do here. So I'm going to start with your biceps. Just kind of rest your hand there. And I am going to do your biceps. So I'm just going to do this directly on my hand, and I will feel, you might not see a movement, but I'll be able to feel that. Get your bicep here, and there we go. Okay. I'm going to come around and do it on the other side. Okay, excellent. All right. And then we're going to do your tricep. So I'm going to have you hold your arm out and just kind of let it rest in my arm. Let it rest, and I'm going to get your tricep tendon here, right here. Okay. All right, and we'll do the other side. Okay, go ahead and relax it. Just let that hang in my arm. There you go. Okay. All right, and then we're going to do our brachioradialis. So that one's going to be down here. Got my thumb knuckle. Okay. And then I'm going to do both sides here. Okay. All right. Now the one you're probably the most familiar with, I'm going to let your legs go ahead and hang there. We're going to do your plantar reflexes. So, all right. one more. This is gonna be your ankle or your Achilles. So I'm gonna have you let your leg hang down, and I'm just gonna prop up your foot here a little bit. And check back here. Okay, and the other side. And let it hang. Okay. All right, very good. Okay, and then a couple more things. We are gonna do just some cutaneous stimulation. So I'm gonna feel right along the bottom of your foot here, and oh, yep, right up there. Sometimes that'll curl your toes a little bit, but it's okay if it doesn't. Okay, all right, go ahead and lay flat here. And I'm gonna do one last test. This is the abdominal cutaneous stimulation. Are you okay if I pull this up a little bit? Okay, all right, so just gonna kind of make a V here going toward the belly button, and I'm not seeing any like guarding or anything like that. Is that painful at all?
Nope.
Okay, all right, you can go ahead and pull that back down. All right, go ahead and sit on up. So that is the end of our neurological exam. Thank you very much for your time. Do you have any questions?
Nope, I'm all good. Thank you so
Okay,
much.
You're welcome.